Hello and welcome to another live broadcast with MedStar Health. My name is Mishan Bowman and today I'm joined by Dr. Raghuveer Vallabhaneni, our Director of Vascular Surgery for the Baltimore region. Today we'll be discussing how to navigate vascular disease during the COVID-19 pandemic. There's a lot of information out there, and for patients with vascular disease or suspected vascular disease, COVID-19 can present unique challenges. So in this discussion, we'll explain the link between COVID and vascular disease, signs and symptoms of vascular disease, and when is the right time to seek care. So if you'd like to learn more, stick around, share this broadcast with your friends on social media, and give us a like to let us know that you're watching. We also encourage you to share your questions and comments in the comment section below. So thank you, Dr. Vallabhaneni. Welcome, and thank you for joining us today.
Thank you, Mishan.
Really appreciate you taking time today. Before we begin, could you tell us a little bit about yourself and the work you do here at MedStar Health?
Sure. My name is Dr. Raghuveer Vallabhaneni. I'm the Director of Vascular Surgery in the Baltimore region here at MedStar Health. We treat all sorts of vascular conditions here at MedStar, and I am happy to discuss how vascular disease has been affecting patients during the COVID-19 pandemic and how to help navigate that.
Thank you very much. So let's get into our questions. So first off, what is vascular disease?
So that's a great question. A lot of times it is confusing to patients when they hear the terms vascular disease. Vascular disease refers to an abnormality in the blood vessels that allows blood to circulate throughout your body. So the arteries take blood from the heart to the rest of the body, and the veins return it. So disease in the arteries is usually caused by cholesterol plaque that can be caused from a lot of different risk factors, such as people get older, they develop plaque, history of diabetes, smoking history, or genetic problems. A family history of cardiovascular diseases could also lead to abnormalities of the arteries. Veins could develop clots or scarring as well, which could cause problems returning blood flow to the heart. So that is exactly what vascular disease is.
Thank you. Could you explain some of the symptoms of vascular disease, and at what point should a patient see a specialist or a vascular surgeon?
Sure. So there are a lot of symptoms of vascular disease, as there are, blood vessels go throughout the body. So one of the most common areas that vascular disease can present is in the legs. So if someone does have a problem with blockages in their leg arteries, they could have pain when they walk. They could potentially have pain in their foot or lower leg, even when they're not walking, if it's severe enough. They could have discoloration or coolness of their legs. They could also have wounds or sores that aren't healing or that open up spontaneously. Those are all signs and symptoms of vascular disease in the legs. If someone has a narrowing in the artery going to their brain and their carotid arteries, they potentially could have signs and symptoms such as a facial droop, arm weakness or leg weakness on one side of their body, speech disturbances such as slurring of the speech or not able to get words out and your mouth not working properly. And those are the main signs and symptoms of a potential blockage, which could lead to a stroke or a mini stroke. People with aneurysms, which are abnormal enlargements of the artery, usually in the abdomen or in the belly area, if it's severe enough, could have things such as severe back pain or abdominal pain, which is usually sudden in onset. And all those things, if you do have any of those problems or those signs or symptoms that I mentioned, it's best to seek medical care and be evaluated and potentially see a vascular surgeon if the provider feels that it is appropriate.
So is there a direct connection or possibly an indirect connection between vascular disease and COVID-19?
That's a great question. There's a lot of information that we have discovered as physicians and scientists over the past several months as the world has been engulfed in this pandemic. So COVID-19 is the virus can affect the blood, the vessels in the circulatory system directly. Initially, we thought that it was primarily a lung disease, but as we discovered, it may also directly affect the blood vessels. And when it does, it can cause things such as injury to the blood vessels and clot of the blood vessels, which can lead to problems such as clots to the lungs, as well as strokes with clots to the brain, or even clots to the lower extremity. Having vascular disease does lead to an increased risk of having more severe complications of COVID-19. Your body, when it has a severe inflammatory response, it's a pretty big shock to the system. And so if you do have underlying comorbidities, such as vascular disease, you may lead to greater complications. Studies have shown that patients with vascular disease and vascular risk factors, like I mentioned previously, such as obesity, hypertension, coronary artery disease, or diabetes, may have an increased risk of being hospitalized and also an increased risk of dying potentially if they were to have COVID-19.
So it could lead to very serious consequences.
Yes, so it's a very important for patients with risk factors, especially things like vascular disease or cardiac disease, to be safe as well as they can, follow CDC guidelines and recommendations, and try to protect themselves as much as possible.
Thank you very much. That's very important to know. So for patients with no history of vascular disease, can COVID-19 cause vascular side effects? And if so, what are some of those side effects?
So it's been interesting that even patients who are younger patients and do not have any history of any vascular risk factors can be affected by COVID-19 and it affects their vascular system. There have been reports of patients in their 40s having strokes, which is very unusual in patients without risk factors. There have also been increased reporting of blood clots in patients who are hospitalized with COVID-19, even though they don't have significant risk factors for that. There's some peculiar things with COVID-19 that people have discovered. There's COVID-19 toes, where their toes have become purplish looking, which has been like somewhat of a long-lasting problem in some patients who have been infected with COVID-19. The long-term effects have not clearly been delineated, as we've only known about this virus for the past year or so. So I think the long-term effects are to be still seen. But if you do have a blood clot, which affects your lung, which could go to your lungs, or you have a stroke, there could be long-lasting impact of having those problems of lack of blood flow to those areas.
Now, are any of these side effects reversible, or is the damage permanent?
I think that it's still too early to tell. If someone was to have a stroke, they may have, a lot of patients do recover from strokes. If they do have blood clots to different organs, it depends on how quickly they are able to get care to remove the blood clot on whether or not the damage is permanent or not.
Thank you. So I've also heard that patients who are hospitalized with COVID can have an increased number of strokes, as you mentioned earlier. So what exactly causes this, and who is especially at risk for having a stroke with COVID?
So patients who, like as I mentioned before, patients with COVID-19, it can affect their blood vessels by the virus directly infecting the blood vessels. And if that were to happen, it could cause inflammation, which causes an increased risk of clotting. If there is increased risk of clotting, you are prone to have a stroke. So patients with more severe infections are more likely to have strokes. Also, if you have pre-existing vascular disease or narrowing in your neck arteries, you may also be more predisposed to have a stroke because you already have a narrow artery. Because COVID-19 can also infect things such as your heart, it can cause decreased function of your heart as well in some patients, and in certain situations that could also lead to a stroke.
Thank you. If you're just joining us, thank you for tuning in. We're speaking with Dr. Raghuveer Vallabhaneni, our Director of Vascular Surgery for the Baltimore region at MedStar Health. We're discussing the link between COVID-19 and vascular disease. We have more to talk about, so keep watching, share this video with your friends, and give us a like to let us know that you're watching. Also, feel free to share questions and comments below. So back to our questions. Are there any cardiovascular medications that could make someone more susceptible to getting COVID-19?
So that's a great question. There's been a lot of studies on this because one of the receptors for COVID-19 is called the ACE2 receptor, and there are certain cardiovascular medications such as ACE inhibitors, which may potentially, people thought, may affect the ability of a patient to either get COVID or resist COVID-19. So far, every study that I've evaluated has not really shown any reason to discontinue any of your cardiovascular medications because of worry of contracting COVID-19. In fact, if by taking your medications, you are treating your cardiovascular disease, so that actually helps you potentially resist COVID-19 infection. So it's important to continue seeking medical care for your vascular or cardiovascular conditions, because that could help you prevent you from getting in the hospital and being sicker from either COVID-19 or your cardiovascular conditions. And that's important to bring up, that your vascular conditions exist now even during COVID-19 as they did before. So it is important to continue to get treated for your vascular disease so you don't have a permanent problem such as a blockage that may progress to someone losing their leg if it's not being effectively treated, or a narrowing in their artery, which could potentially lead to a stroke. It's very important to continue seeking medical care for your vascular problems as you find out that they exist.
Thank you. If a patient has vascular disease but also has diabetes, do you have any special considerations or recommendations for someone with these two very serious conditions?
Yeah, so with having diabetes does put you at increased risk of being more severely ill if you do get infected with COVID-19. So first of all, as with anyone listening to this broadcast, please follow CDC recommendations and guidelines to help protect yourself from contracting the virus. These include social distancing, washing your hands, staying 6 feet apart, wearing a mask. These are all very important things to help prevent you from getting infected so you don't become sick. As I mentioned earlier, you should also try to keep control of your underlying comorbidities. So if you have diabetes, try to keep your sugar controlled so you're not more ill, so if you do get infected, you don't become more sick.
So for those who may be concerned about coming into a hospital right now, what are the risks for delaying care and waiting to have a vascular procedure?
Yeah, that's a great question, and a lot of my patients bring that up. I think that for the most part, our hospitals, we do follow CDC recommendations and are quite safe. We're not putting patients at risk by bringing them in to do procedures. What patients need to know is that potentially, depending on the procedure and the severity, there's some procedures that you might have a poor outcome by delaying the care, and it's unclear which patients exactly that poor outcome would happen to. So if you do have a severe critical blockage in your legs, and you are having pain or a wound, if you do delay that care for a long enough period of time, there's a potential of losing that leg. That's not all patients, but there are certain patients who it is very important to continue getting and continuing your procedures that are needed. As vascular surgeons, many times if you do have one of the symptoms of vascular disease that I mentioned earlier, such as pain in your legs, signs and symptoms of mini strokes, signs and symptoms of peripheral arterial disease, there are things that we could do, including medical management, to help protect you that does not require a procedure. So I do think it is very important to continue seeking medical care and not to wait, because the same medical problems that existed last year exist now, and we just have the COVID-19 pandemic to have to deal with, but we still have to take care of ourselves and to help protect us from getting severely ill.
Thank you. We received a few questions on social media, and one of them sort of connects with what we talked about earlier. It's from Judy. Thank you very much for tuning in and sharing your question with us. She asks, can vascular problems show up or present months after having a COVID infection? So say you were infected with COVID and possibly you have recovered, could possible complications come back if you have vascular disease?
I think a lot of that is still unknown. It is possible. It's also possible that you do have underlying vascular disease that may just show up months later and during its natural progression that had nothing to do with COVID, especially if you have a history of risk factors, such as if you're older in age, history of cardiovascular problems in your family, diabetes, or smoking. All of those things could present with vascular disease at any point in time. So I think it's always important to be wary of the development of further complications. But right now, I think it's too early to tell long-term effects of COVID-19 on vascular disease.
If a patient suspects that they may have vascular disease, can it be diagnosed through a video visit if they choose not to come in, or if they do, would they be able to come into the office? Is there any flexibility there?
That's a great question. We have a lot of flexibility here in MedStar Health, where we offer both in-person and telehealth visits. The benefit of an in-person visit is that we do have the vascular lab and capabilities of actually doing tests to diagnose the vascular disease directly in the office. So we'd be able to tell you in real time and definitively what type of problem you may or may not have. But in certain situations, telehealth is another great option where we could discuss with you, especially if you feel uncomfortable about the need for either further testing or an intervention, or just really speak to one of our vascular surgery experts on what exactly your problem or complaint is. And we've really done quite a few telehealth visits as well throughout the pandemic.
Thank you. It's very good to know. Are hospitals open to taking patients, say, for instance, they have vascular disease, but perhaps their condition seems to be getting worse? What's the process?
So yes, the hospitals are still open. A lot of vascular disease is not necessarily considered an elective surgery, although we're still doing elective surgeries now, because there is the risk of possibly having things like an amputation or a stroke or a ruptured aneurysm, depending on the individual patient. We are still open to taking care of these patients. So although there's been a recent surge in COVID cases throughout the country, here at MedStar we are still equipped and we are still definitely taking care of patients, including vascular surgical patients.
Thank you. So we received a few more questions on social media. Thank you very much for tuning in and watching and sharing your questions. Keep them coming. I want to go to a question from Barbara. Thank you very much for sharing this. She asks, why do those with diabetes have so much nerve damage in their feet and legs?
Sure. So diabetes does cause something called neuropathy, which could potentially be prevented or treated earlier if the diabetes is diagnosed earlier. Over a long period of time, what happens is that having diabetes and elevated blood sugars could actually damage the nerves prior to damaging other portions of the body. So when the nerves get damaged, you do have what we call neuropathy or nerve pain, which usually is in the distribution of either like basically where your socks would be, from in both of your lower legs up to the mid calf, or potentially even in your hands, like how your gloves would be. And so that is sometimes be a challenging aspect to treat, but there are medications that potentially can be used to treat patients with that problem.
Thank you. We have another question from Renu. I hope I'm pronouncing that correctly. Thank you for sharing your question. They ask, does low blood pressure cause more cardiovascular problems if you also have COVID?
I think that's a relative question. Depends how low the blood pressure is. High blood pressure, I think, is worse than normal blood pressure. Normal blood pressure being generally between the top number being between 100 and 120. That's relatively normal blood pressure, but we're usually more worried about high blood pressure during as an elevated risk factor for COVID. Now that being said, if your blood pressure is remarkably low, that could lead to its own problems irrespective of COVID. So that should be followed up with your medical provider.
Thanks. We have a question from Mark. Thank you very much for sharing this. He asks, if your feet feel sluggish, could that be a sign of vascular disease? And also, what are the symptoms you might feel in your feet?
Sure. So that's a great question. Sometimes it could be difficult to figure out if someone has pain in their legs, what the exact cause of that is. And a lot of times it could be a lot of different factors. Sometimes if you have aching in your legs at the end of the day, and you have some swelling in your legs, that could be related to a problem with your veins or the venous side, returning blood not well enough back to your heart. If you have pain when you walk in your calves or your feet, and it's pretty, you're able to repeat that and it happens every time, that's likely due to blockages in your arteries. So there are different ways. It could be a sign of vascular disease if you do have a sluggishness in your legs. And I think speaking to a medical provider or a vascular surgical specialist will be able to determine whether or not it is from that or from sometimes people have back pain, which is referred to their legs, which is causing the problem.
Thank you. We have another question from Tina. Thank you for sharing this. She says, Does PAD or peripheral artery disease, patients with that condition have a higher instance of amputation if you've also been affected by COVID?
I think that there's not enough data to know that for sure. I think that if you do have peripheral artery disease, you're more susceptible to being hospitalized and having a more severe COVID infection. Potentially, you would be at increased risk if you have a COVID infection versus someone who does not have peripheral artery disease. But I think that how much of an increased risk factor for amputation is unclear. That being said, I just want to reiterate, it's very important to continue seeking medical care for your vascular disease conditions so that you do prevent things like amputations, and also to continue following CDC guidelines such as masking up and social distancing.
All right. We have a few more questions coming in. All right, another question from Tina. Thank you very much again for sharing this. She asks, what are common signs and symptoms of neuropathy?
Sure. So a lot of times what neuropathy, how it feels, a lot of times it could be like burning or stinging of your feet. It's also a numbness. So people with diabetes have to be very careful of watching that checking their feet to make sure they don't have any sores on their feet, because they're unable to feel things that would irritate someone who does not have diabetes or does not have potentially neuropathy, because they're able to feel better in their feet. So if you have a pebble in your foot, you step on a nail or a tack, if you have diabetes, you may not be able to notice it. So typically it's more of a constant burning sensation or tingling in your legs, also a numbness that you're not able to feel things appropriately in your feet.
Thank you. Thank you very much. And thanks again, Tina, for sharing that question with us. That wraps up our broadcast. Dr. Vallabhaneni, thank you very much for spending time with us today. And thank you very much to our viewers for tuning in and sharing your questions with us. We hope you found this useful information and very valuable for achieving good health. For more information or to schedule an appointment, please call 410-554-2950. Thanks, and we'll see you next time.
Thank you, Michelle. Be safe, everybody.